Hello, my name is Susan Blank, and I'm an endocrinologist who works with the Virginia Department of Health. Thank you for joining me for this learning session, which is part of the Virginia Healthy Hearts Initiative. Today, we'll be talking about high cholesterol and how to lower your cholesterol and improve your heart health. Let's get started. We're going to start by discussing the connection between cholesterol and cardiovascular disease, then move on to discuss what determines cholesterol levels, testing and target levels, and prevention and management. How does cholesterol cause heart disease? Excess cholesterol in the bloodstream causes plaque to build up in the artery walls. This leads to narrowing of the blood vessels and restriction of the blood flow. Eventually, clots can form, which can entirely cut off the blood flow, leading to tissue damage and death. And we can see this all illustrated in this diagram. This first artery has nice smooth walls and good blood flow throughout. By the second artery, we start to see the buildup of some plaque, which are these yellow areas in the blood vessel walls. At this point, it's still pretty minimal and there's good blood flow. By the third artery, we start to see more significant buildup of plaque in the artery walls, which is causing some restriction of blood flow. If this blood vessel was in the heart, this might be the time where somebody can feel fine at rest, but they start to develop some chest pain with walking or climbing upstairs because the body isn't able to increase the blood flow through this artery as it would want to with activity. And then by this fourth artery, you can see the plaque is built up to the point where it's almost entirely restricting the blood flow. Because the blood flow is so sluggish, clots can form here, which would entirely cut off the blood flow and lead to downstream tissue damage and death. If this happens in the heart, that's when you get a heart attack. The process that I just described is happening throughout the body. If it's affecting the arteries in the heart, it can lead to heart attacks. If it's affecting the arteries in the brain, it can cause strokes. And if it's affecting the arteries in the legs, it can cause peripheral vascular disease, which can lead to non-healing ulcers and the need for lower limb amputations. The risk of cardiovascular disease is related to the lifetime exposure to high cholesterol levels. And this lifetime exposure has two different elements. The first is the degree of cholesterol elevation, so how high are your cholesterol levels? And the second is the duration of cholesterol elevation, so how long is your body exposed to those high cholesterol levels? Because we know that the risk accumulates over a lifetime, it's very important for high cholesterol to be diagnosed and treated early in order to protect heart health. There are three main types of cholesterol that we measure in the blood: LDL cholesterol, HDL cholesterol, and triglycerides. LDL cholesterol is also sometimes known as the bad cholesterol. It transports cholesterol from the liver to cells throughout the body. And if there's too much LDL cholesterol, it can build up in the artery walls, creating that plaque that can restrict blood flow and lead to heart attacks and strokes. For LDL, lower is better. And you can remember that because both LDL and lower begin with the letter L. HDL, on the other hand, is sometimes known as the good cholesterol. Its job is to transport cholesterol from the body back to the liver for removal. And for HDL, higher is better. And you can remember that because both HDL and higher begin with the letter H. The third form of cholesterol that's measured in the blood is triglycerides. This is a storage form for excess energy that travels through the blood and it's stored in fat cells until it's needed. And as far as cardiovascular risk, lower triglycerides are better. To summarize the effect of the different types of cholesterol on heart disease risk, high LDL, low HDL, and high triglycerides all increase the risk of heart disease, whereas lower LDL, higher HDL, and lower triglycerides all decrease the risk of heart disease. Now we're going to move on and talk about what determines cholesterol levels. There are two main factors that determine cholesterol levels. The first is genetic, so this is an inherited component that we don't have any control over, and the second is diet, which we do have control over. On the genetic side, there are genetic variations in how the liver produces, packages, and removes cholesterol from the body that can affect the cholesterol levels. And because of this, high cholesterol can run in families. If possible, it's a good idea to have some conversations with your older relatives and find out if yours is one of those families where high cholesterol is common. On the diet side, foods that are high in saturated fats, these include things like dairy products and meats, can raise cholesterol levels, whereas foods that are high in fiber can lower cholesterol levels. And these are foods like fruits and vegetables and beans and whole grains. One of the most common and severe forms of genetic high cholesterol is something called familial hypercholesterolemia. It's also sometimes known as FH, and this occurs in a couple different forms. The first one, which is more severe, is called homozygous FH. In this situation, the person has inherited the genetic trait from both of their parents. It fortunately is rare. It only occurs in around 1 out of 300,000 people, but the presentation of it is very dramatic. We see heart attacks in children as young as 7 or 8, and there are also cholesterol deposits in the tendons and eyes and skin of people who have this. So we can see those in these pictures here. We see cholesterol accumulations in the tendons on the hands in this picture, and in the Achilles tendon, which is on the back of the heel in this picture. On the eye, we see this white rim of cholesterol deposit, and then it also creates deposits under the skin, especially around the eye. So again, fortunately, this is very rare, but it's severe, and it's something that's important to know about if it runs in your family and to be diagnosed early. The more common form is something called heterozygous FH. In this situation, it's only inherited from one parent. It's much more common. It occurs in around 1 out of 300 people, and it does not increase the cardiovascular risk as dramatically as a homozygous form, but it does increase it by 2 to 4-fold over the course of someone's lifetime. And if we just look at young adults, it increases it more dramatically by around 17-fold. People who have this tend to develop heart disease at younger ages, and most people don't have any symptoms until they actually develop a heart attack or stroke. 90% of people don't know that they have it, which is why screening for this is very important. If we are able to diagnose and treat it early, we can help prevent or delay heart disease. So the screening recommendations for this are to start as early as age 2 for children who have a family history of familial hypercholesterolemia, and to do universal screening for children between the age of 9 to 11 to catch any other cases. And if someone in the family is diagnosed with familial hypercholesterolemia, then the recommendation is for all other first-degree relatives to be tested to see if they also have it. Now we're going to shift gears and talk about testing and target levels. When should cholesterol be checked? In addition to the universal screening for children that we already discussed, it's recommended that adults be screened regularly for high cholesterol. Usually this is done with a blood test that is called a lipid panel or a lipid profile that includes a total cholesterol, LDL cholesterol, HDL cholesterol, and triglycerides. It's recommended that everyone get this at age 19, and then it be checked again about every 5 years or more frequently in people who have borderline high levels or who have other cardiovascular risk factors. There's also a new recommendation that everybody get something called a lipoprotein little a checked once during their lifetime. This is an independent risk factor for cardiovascular disease. It is elevated in approximately 1 out of every 5 people, and if it's high, it is associated with a 1.5 to 2 times increased risk of cardiovascular disease. So if it's high, it's important to know that, and it may indicate the need for more aggressive cholesterol management, as well as the management of other cardiovascular risk factors. If someone is already being treated for high cholesterol, it's also recommended that they get a lipid panel checked 4 to 12 weeks after a new medication is started, or if any adjustments in the dosage have been made. And other than that, that it be checked at least every 6 to 12 months to make sure that the cholesterol levels are being adequately controlled. Appropriate cholesterol levels and treatment goals depend on the individual risk for cardiovascular disease. So different people will have different targets, and your targets may change over the course of your lifetime as your cardiovascular risk evolves. So it's very important to have a discussion with your healthcare provider so that you can better understand your own risk and the target levels that are right for you. In general, people who have low to intermediate risk of cardiovascular disease are recommended to have an LDL level under 100. These are people who have an estimated 10-year cardiovascular disease risk of less than 10%. We'll talk in a minute about how that is estimated. For people who are at high risk, it is recommended that they have an LDL level that is under 70. These are people who have an estimated 10-year cardiovascular disease risk over 10%, familial hypercholesterolemia, diabetes with other cardiovascular risk factors, or something called a coronary artery calcium score, which is over 100. That's done through a special CAT scan. And for people who are at very high risk, it's recommended that they keep their LDL under 55. These are people who have known cardiovascular disease, so already have had, in many cases, a heart attack or a stroke. Your healthcare provider can estimate your 10 and 30-year cardiovascular risk using a model that's incorporated into the American Heart Association Prevent online calculator. This model has been validated for people between the ages of 30 and 79 without known cardiovascular disease, and it incorporates a bunch of different clinical factors, including sex, age, blood pressure, cholesterol levels, kidney function, body mass index, diabetes status, smoking status, and whether or not you're on blood pressure and cholesterol medications. And once all that information is put in, it gives you a result which estimates both your 10-year risk of cardiovascular disease and your 30-year risk of cardiovascular disease, and your healthcare provider and you can use these to help determine how to best address your cardiovascular risk factors, including your cholesterol levels. We're going to finish up by talking about prevention and management of high cholesterol. There are three main things that you need to do to effectively prevent and manage high cholesterol. The first is to know your numbers, the second is to live a healthy lifestyle, and the third is to take medications if needed. The first step is to know your numbers. Checking your cholesterol is the only way to know if it is too high, and you can't take control of something if you don't know what you're dealing with. All adults should have a lipid panel checked at least once every 5 years, and adults with elevated cholesterol or who are taking cholesterol-lowering medication should have a lipid panel checked at least once a year. Ideally, this would be done as part of your routine healthcare through your primary care provider, but sometimes you can also get your cholesterol checked at community screening events. And there is a foundation called the Family Heart Foundation that has a program that offers free at-home cholesterol screenings that include both a lipid panel and a lipoprotein little a. You can go to their website, which is familyheart.org. I've also included a QR code that will take you there and order a test kit from them. The next step is to live a healthy lifestyle. Everyone, including both children and adults, should live a healthy lifestyle in order to minimize their risk of high cholesterol and heart disease. And a healthy lifestyle has a number of components. It includes eating a healthy diet, being physically active, maintaining a healthy weight, not smoking, managing stress, and getting a good night's sleep. We're going to focus primarily on the first two, eating a healthy diet and being physically active, because these have the biggest impact on cholesterol levels, but all of these components are important to minimizing your risk of heart disease. When we're thinking about a healthy diet from the perspective of trying to prevent or manage high cholesterol, one of the things that we want to pay attention to is what types of fats we're taking in. Fats sometimes get a bad rap, so I wanted to start by saying that dietary fats are essential. They give our body energy and support cell growth. They protect your organs and keep your body warm. They help your body absorb nutrients and produce important hormones, and they also provide essential fatty acids that the body can't make itself. But some dietary fats are healthier than others. The goal here is not to entirely eliminate fat from our diet, but just to make sure that we're eating primarily the healthier fats. We're going to start with the worst kinds of fats. These are trans fats and hydrogenated oils, and these are a type of fat that you want to avoid entirely. These are found in fried food, packaged baked goods, and other highly processed foods, and they raise the bad LDL cholesterol and are consistently associated with increased risk of heart disease. Fortunately, these have basically been banned from the US food system, which makes them easier to avoid. However, they can still be found in small amounts. And so if you're eating a lot of servings of these types of foods every day, it can add up, and even small levels of these can be very dangerous for heart health. The next type of fat is saturated fat, and this is a type of fat that we want to try to eat only in limited amounts. Saturated fats are found in fatty meats, full-fat dairy products, and tropical cooking oils like palm oil and coconut oil that are commonly used in commercially prepared baked goods and other processed foods. One tip off that something includes saturated fats is that it is usually solid at room temperature. So you can think about butter or shortening or coconut oil, all of which are solids at room temperature. And saturated fats raise the bad LDL cholesterol level and also increase the risk of heart disease. The third type of fat, which is the healthiest type of fat, is the unsaturated fats. These are found in fish, nuts, seeds, soybean products like tofu and edamame, and in plant oils like olive oil and canola oil that are liquid at room temperature. They lower the LDL or bad cholesterol. They also lower triglycerides and the overall risk of heart disease. And they provide essential fats that the body needs but can't make on its own. One practical thing that you can do to improve the quality of your diet is to substitute unsaturated fats for saturated or trans fats. And here are a few examples. Instead of using solid fats to cook, including butter, lard, and shortening, you can use liquid plant oils, including olive oil and canola oil. Instead of eating fatty meats, you can try fatty fish. And if you're craving a salty snack, instead of chips, which are often high in saturated fats and sometimes trans fats, you can eat nuts. Another thing to pay attention to in your diet is your fiber intake, because high fiber intake can lower LDL cholesterol and improve heart health. Fiber is a complex carbohydrate that doesn't get absorbed by the body, and it decreases LDL by trapping and eliminating cholesterol from the gut. It also has a variety of other benefits. It can help people feel full, so they eat less. It decreases blood sugar spikes after eating, and it also improves gut bacteria and bowel regularity. And it's found in a bunch of different foods, including whole grains, fruits, vegetables, beans, nuts, and seeds. It's estimated that only around 5% of Americans are getting enough fiber, so this is something that most of us could use some work on. It's also important to try to be physically active. Physical activity increases HDL cholesterol and lowers LDL cholesterol and triglycerides, in addition to a variety of other heart health benefits. The recommendation is for adults to try to get at least 150 minutes a week of moderate intensity physical activity. Moderate intensity is defined as a level at which you could carry on a conversation but wouldn't be able to sing. And 150 minutes comes out to exercising for around 30 minutes, 5 times a week. If you're not there yet, it's fine to just start wherever you are and gradually try to build up slowly. The goal here is progress, not perfection. And some tips for trying to stick to a regular exercise routine include finding forms of movement that you enjoy. Walking can be a great exercise for a lot of people. You can do it almost anywhere, and all you really need are a decent pair of walking shoes. But if you like to play pickup basketball or pickleball or to do water aerobics, great. Just do whatever you enjoy and can stick to. Another tip is to try to make it social. If you're active with a friend, it makes it more fun and also adds in some accountability because you're less likely to skip a workout if you're doing it with someone else. And lastly, if finding time is a challenge for you, you don't have to do this 30 minutes all at once. You'll get most of the same benefit if you divide it up into chunks and do 10 minutes 3 times a day instead of 30 minutes all at once. The final step is to take medications if needed. Because of the large genetic component to cholesterol, even with a healthy lifestyle, many people will end up needing medications to control their cholesterol at some point during their life. The main type of medications that we use are a group of medications called statins. These are first-line therapy for most people. They've been around for a long time. They are safe, effective, and affordable, with many of them available as a generic version. And they have a lot of benefits. They can lower the LDL cholesterol by up to 50%. They also decrease inflammation, and they have been shown in multiple studies to lower the risk of heart attack and stroke. Unfortunately, only around 1/3 of the people who would benefit from a statin are taking one, which means that a lot of people are at unnecessarily high risk for heart attacks and strokes. And there are a number of reasons for this. For some people, it has to do with healthcare accessibility and affordability. For others, it may be because their doctor has never offered them a statin. But for a lot of people, it has to do with concerns about side effects. So I wanted to spend a few minutes talking specifically about statin side effects because in general, these are very well tolerated medications, and for most people, the benefits far outweigh the risks. So as far as side effects, one thing that people worry a lot about and experience a lot are muscle aches. However, in large studies where people were taking either a statin or a placebo, which is basically a sugar pill, and they didn't know which one they were taking, just as many people in the placebo group dropped out because of muscle aches as in the statin group. My takeaway from this are that muscle aches are really common and they're really bothersome, especially in middle-aged and older people who tend to be the ones who take statins, but it doesn't seem like there's really any increased risk of muscle aches specifically caused by the statins. There are rare cases of severe muscle damage with statins, but these are very rare and only affect a handful of people. So they're not something that is a general worry for the larger population. Another concern is increased liver enzymes. This can happen with statins. It's usually mild and the medication doesn't need to be discontinued. It's something that can just be watched. But if you're started on one of these medications, your physician usually will monitor your liver function test along with your lipid panel, and they can catch early if something is happening in your liver. And then the other risk that people worry a lot about are increased blood sugars. This can happen with statins. Again, it's usually mild. And because high blood sugars and diabetes are associated with high cardiovascular risk, even with a mild elevation in the blood sugars, the benefits of the statin for heart health and reduction of cardiovascular risk usually outweighs the negative effects of the higher sugars. So in general, most people tolerate the statins really well, and if you're having a hard time tolerating them, then there are other things that we can do. So it's worth a try. If you do develop side effects on a statin or have difficulty affording your medication, it's important that you talk to your healthcare provider because there are other options. Options include switching to a different statin. There are a bunch of these medications, and a lot of times people can tolerate one but not the other. You can also try decreasing the dose. Sometimes people can tolerate a lower dose but not a higher dose. And if neither one of those work, then we can switch to an alternative LDL lowering medication. These include ezetimibe, which goes by the brand name Zetia, PCSK9 inhibitors. These include medications like Repatha and also bempedoic acid. There are also a lot of supplements out there that are being marketed as heart healthy and lipid lowering. However, none of these have enough data that they are recommended for cholesterol lowering at this time. I want to finish up by zooming out for a couple minutes and talking about how we can help prevent and control high cholesterol in our communities. The first is to lead by example. Know your numbers, make healthy lifestyle choices, and take medication if needed. If people see you taking control of your cholesterol and heart health, they will be more likely to do the same. Next, share and educate. Talk to your family and friends about the importance of cholesterol screening and control across the lifespan. This is especially important if high cholesterol or early heart disease runs in your family. You can also help organize heart healthy activities, things like cholesterol screening events, education sessions, and cooking classes. And lastly, advocate for change. Support policies for more helpful food labeling, for better coverage and lower prices for some of the newer cholesterol tests and medications, and also for making LDL control a quality standard that impacts the bottom line of healthcare systems so that they have a financial incentive to optimize LDL control in the populations that they serve. This concludes today's session. Thank you very much for your time and attention. If you're interested in more information on high cholesterol and heart health, you can find that on the VDH website. I've listed the address here along with a QR code that will take you there. Thank you very much and have a wonderful day.